Hello, everyone, and thank you first and foremost to the British Association for Paediatric Nephrology and the UK Kidney Association, or UKKA, for allowing me the opportunity to present this work from a virtual perspective on an important topic in pediatric nephrology. Pediatric nephrologies on this topic titled Henoch-Schönlein Purpura, or HSP, and the full title of this work is What Can We Learn from Biomedical and Clinical Anatomy Practice on this multidisciplinary disease. And I want to say from the outset that this was a collaborative work dating back from May 2018, where the work in the run up to May 2018 was formed a peer review publication between my colleagues. In Queen University Belfast, and also in a pediatric nephrology department in Lille in France. So I want to say thank you to my collaborators for helping me put that work for peer review publication back in 2018. This work is kind of it will be a summary of that work that was dated back then, and by no means does it make it any less of a perspective. So I hope that the British Association of Paediatric Nephrology have this perspective from other colleagues as well, with the works that they may be doing in the different in different centers. And so I'm going to give a quick run through of this work in an abstract format. So a bit of background to begin with. Henoch-Schönlein Purpura is the most common vasculitis condition in children or young people, characterized by a triad of symptoms. So number one, there's palpable purpura without thrombocytopenia. Number two, abdominal pain, and number three, arthritis. Renal involvement or kidney involvement also often occurs in children with HSP. And HSP is one of the most common conditions in children and young people, occurring in retrospectively has been documented as occurring in 8 to 20 or close to 21 per 100,000 children per year, or young people. The epidemiology perspective on this is that HSP usually occurs in children aged between 2 to 10 years old, but half of all the cases have occurred in children that are actually less than 5, on average less than 5 years old, mostly in children aged 4 to 6. And occurs more frequently in the male, from those on the male background, male gender background. HSP can cause renal manifestations with various indices. So there are various manifestations where kidney involvement has lots of involvement in relating to disease processes. The guidelines and treatment for managing care in HSP patients in children and young people ranges between centres, and ranges between different nephrology departments in and around the UK and in other parts of Europe. in Europe and in other parts of the regions of the world. The aims of this work really were to provide a practical understanding of Henoch-Schönlein Purpura. Number two, to highlight the importance of multidisciplinary laboratory practice for patients with HSP. And number three, to highlight what laboratory practice could be enhanced to support the development of HSP guidelines. HSP is a multidisciplinary specialty disease wherein a patient's care plan will have laboratory involvement from a variety of laboratory disciplines, and laboratory investigations or different types of laboratory investigations suggest that HSP is not a self-limited disease, and patients eventually, unfortunately, will develop chronic kidney disease or a form of chronic, will fall into chronic kidney disease categories, stages 1 through 5. The research stance on this, or the main research perspective on this, is that in a paper by Zhao in 2015, a retrospective study of 141 patients with HSP demonstrated that abdominal pain was related to HSP nephritis or HSPN. However, 45% of the patients were complicated by other comorbidities, and 29.8% or close to 30% of the patients had a long-term disease course up until the point of being involved in this retrospective study by Zhao, where Zhao and team in 2015 highlight their work. Multidisciplinary laboratory perspectives are paramount in disease follow-up and to help inform clinical decision making. The discussion around this, in keeping with everything else, really, more case and longitudinal studies would be helpful to understand whether patients would benefit from different care plan options, and the conclusion around this work is that evidence informs that male gender age greater than 10 years old have symptoms of severe gastrointestinal involvement, early onset of arthritic or arthritis or arthralgia, and then certainly well-designed and conventionally reported studies surrounding histology, microbiology, and hematology laboratory collaborations are important to identify HSP disease development and progression. And so I want to say thank you again for allowing me the opportunity to present this work through this from a virtual perspective, and I do hope that generally there are nephrologists, pediatric nephrologists that are looking into highlighting that more around HSP in future areas of pediatric nephrology practices. And finally, I want to say I would like to dedicate this work to one of the founders or co-founders for the Renal Patient Support Group, the RPSG. That's John Gardner, who has lived with has lived with HSP, since his early teens. So I want to put that forward as a dedication for this work in relating to the co-founder for one of the co-founders for the Renal Patient Support Group, the RPSG, John Gardner. Thank you again for the UKKA and the British Association of Paediatric Nephrology for inviting me to present this work, and If there is any follow-up questions, do feel free to follow up with the Renal Patient Support Group, the RPSG. Thank you very much for your time.